Hello friends, welcome to my channel Dr. Love for Medicos. This is Al Amin from Travancore Medical College. Okay, so today we are going to deal with a new topic from this community medicine, that is acute respiratory infections. So guys, so before going to this topic, if you are planning to take some subscriptions from DBMCI, please use my coupon code ALAA90 to get 20% off on your subscriptions. Okay, so let's move to our topic. So our today's topic is acute respiratory infections. So from community medicine. Okay, so what's the importance of this topic? So this is a very important topic. So many questions, that is 5 mark questions, short notes, etc. are usually asked from this topic. Okay, so what is acute respiratory infection? So it is nothing but it is just the inflammation of the respiratory tract. Okay, so and we should know what are the causative agents of this infection. So if you consider this case of these children, the most important causes, so they will be measles, then it can be influenza, diphtheria, can be pertussis, as well as it can be H influenza. But if you consider this case of these adults, so this important causes will be Klebsiella as well as Legionella. So these are the important causes of acute respiratory infections. So but the most common it is, so typically there is no age distribution. So this is the most common presentation. Okay, so there is no age distribution. So when you consider this, so streptococcus, okay, streptococcus, and this streptococcus, this is the most common cause of this community acquired pneumonia. And when we consider the staphylococcus, so staphylococcus, so that is the most common cause of this nosocomial, that is known as the hospital acquired pneumonia. And the other causes, so it can be this rhinovirus as well as the coronavirus. Okay, so these are the organisms which do not have any age distribution or age predisposition. Okay, now we are moving to this examination part. Suppose, so you are sitting in a periphery, a hospital, and a case of this pneumonia so was brought to you. So how will you examine this case? We should know what are the parameters that we will use in this physical examination. Okay, so first of all, we should count this breathing rate. This is very, very important. So this is count the breathing rate per minute. Okay, so we can tell that a fast breathing, so fast breathing, it is also known as this tachypnea, it is present. So whenever this breathing rate is greater than or equal to 60 per minute, so in this age category of less than 2 months. Okay, so when this breathing rate is greater than or equal to 50 per minute, so in an age category of this 2 months to 1 year, or when it is greater than or equal to 40 per minute in an age category of this 1 year to 5 year. So in all these cases, we will be telling that this patient is having tachypnea, so which is a sign of this pneumonia, right? So next, the second sign that we have to look for is the chest introing. So this is the most important sign. So if this chest introing is present, then we will categorize that pneumonia as a severe pneumonia, right? Next, we have to look for this presence of this stridor. Next, we have to look as well as listen for this wheezing, then malnutrition, and also we have to check whether this patient is feeling sleepy or this patient is difficult to wake up. So he is experiencing any difficulty to wake up. That is known as somnolence, right? So this somnolence. So next, so we have to check whether there is any fever or low body temperature. And finally, we have to check for cyanosis. So these are the important parameters that we have to check while doing a physical examination for this acute respiratory infection. So now we are moving to this classification of this pneumonia. So this is very important, classification of this pneumonia. So usually in this university examinations, a case will be given. So so and so a child, 5-year-old, so she was brought to your OP, so and you diagnosed her as this pneumonia. So how will you classify this diagnosis? This will be a question. So this is usually asked as a 5-mark short note question. And this classification is based on, so it's based on the acute respiratory respiratory infection control program. So this classification is based on acute respiratory infection control program. So for doing this classification or classifying this pneumonia, first of all, we will be dividing these patients into two age category. So two age category. First category is when this patient is less than 2 months of this age, or when this patient is having age in between 2 months to 5 years. So this is the age categorization. So, and we have to look for, so the signs of this pneumonia in both these cases, that is in less than 2 months and in 2 months to 5 years. Okay, so today in this session, we will be dealing only this classification of diagnosis of pneumonia in these patients who are ranging from this age category of 2 months to 5 years. And this is also usually asked in this examination. So this is more important. Okay. Suppose, so I am going to classify this pneumonia. So this pneumonia in a child who is aged 2 months to 5 years. So this is the age of this child, that is 2 months to 5 years. And I am going to classify this pneumonia in this child. Okay. So first, they can be classified into basically 4 types. Either the child can have no pneumonia. So he's just having some signs and symptoms, but that is actually not pneumonia. So that is no pneumonia. Or it can be a pneumonia itself. Or it can be a severe pneumonia. Or it can be a very severe pneumonia. So this is the way where we classify this pneumonia. Okay. So a pneumonia in a child who is aged 2 months to 5 years. So it can be classified as this no pneumonia, pneumonia, severe pneumonia, and very severe pneumonia. And there is a color code. So there is a color label has been established. If this patient is having no pneumonia, it has been labeled as green. Okay, so and if this patient is having pneumonia, then it is labeled as yellow. So but if this patient is having a severe pneumonia, so in severe pneumonia or very severe pneumonia, we will label both these cases as pink. Okay, so this is the color label that is used for this categorization of this diagnosis of pneumonia. Okay, so if the patient is having no pneumonia, that can be labeled as green. So if the patient is having just pneumonia, that is yellow. If this patient is having severe or very severe pneumonia, we will use this color pink. Okay. Now we should know, so what are the signs of this no pneumonia, pneumonia, severe and very severe pneumonia? This is very important. Okay, so first we are moving to the signs. Okay, so in case of this no pneumonia, so no pneumonia means this patient is having, so no tachypnea as well as this no chest introing. So this typical feature of this pneumonia, it is chest introing as well as tachypnea. So just this patient is having cough or this patient is having cold. And also this patient may be having fever. So he may not be having no chest indrawing. So if chest indrawing is present, then we will classify it as a severe pneumonia. So there is no chest indrawing as well as there is no tachypnea. So there is no chest indrawing and there is no tachypnea. So these are the signs of no pneumonia. So if this patient is having no pneumonia, he is having just cough or cold, or he may be having only fever. So these two signs are only present. So and there is no chest indrawing and also there is no tachypnea. If this patient is having pneumonia, again, so what are the signs? The patient will be having fever. Okay, so there can be cough or this cold can be present. And there is tachypnea will be present. So tachypnea, it is a typical feature. So I have already told you, so tachypnea, when it is greater than 50 breaths per minute in this age category of this 2 months to 1 year, or when it is greater than or equal to 40 breaths per minute in an age category of this 1 year to 5 year. So if we are having this breathing count like this, then we will call it as a tachypnea. So in case of pneumonia, we will be having this fever, cough or cold, tachypnea, and also there is no chest indrawing. So chest indrawing is absent here. Okay. So, but if this patient is having a severe pneumonia, then the patient will be having, most important sign, the patient will be having chest indrawing. So this is a very important sign of severe pneumonia. and he will also be having tachypnea. So tachypnea like this, that is greater than 50 breaths per minute in an age category of 2 months to 1 year, and 40 breaths per minute in age category of 1 year to 5 year. Okay. And he may also be having nasal flaring. So nasal flaring means there is flaring of this ala nasi, right? That is nasal flaring. Then in case of very severe pneumonia, the patient will be expressing a specific signs that is known as danger signs of pneumonia. So this is itself asked as a short note. Danger signs alone can be asked as a short note. So in very severe pneumonia, so apart from all these signs, this patient will be also showing danger signs. So we should know what are the danger signs of this pneumonia. Okay, so what are the danger signs? So first danger sign, the child has stopped feeding well. So he has stopped feeding well, or he is unable to drink. Okay. And also this child will be having severe malnutrition. So there will be severe malnutrition, and there can be convulsions in this child. So convulsions can be present in this child. And also there will be somnolence. What is somnolence? Somnolence means there will be abnormally sleepy, or the patient will be very difficult to wake. That is known as somnolence. Okay. And we can also see the stridor in a calm child. So if this child is resting calmly, but we can also hear the stridor. So, and we can hear this wheeze, which may be associated with hypoxia. And also this child may be having fever, or there can be low body temperature. So these are said to be the danger signs. So this is very important. So this is also asked as a short note. So in very severe pneumonia, we will be getting this danger signs. So what are the danger signs? So there will be, the child may have stopped feeding well. He may be having severe malnutrition. He may be having convulsion, somnolence, stridor, wheeze, and also there may be fever or low body temperature. Okay. So in this way, we have categorized this, the diagnosis of this pneumonia. This is often asked as a short note question. Now we should know what is this treatment. Okay, so in every type of this pneumonia, how will you treat this case? So how will you treat? So now we are moving to this treatment of this pneumonia. Okay, so if we consider this first stage, our first stage was no pneumonia. Okay, no pneumonia. So no pneumonia means this patient is having just cough, or he may be having just a cold, like that. So in that condition, if this cough is greater than 30 days, if this cough is persisting greater than 30 days, then we have to move for further assessment. So we can assess for this TB like that. So we have to move for further assessment. And also if there is recurrent wheezing, okay, so if there is a recurrent wheezing, then we have to assess for what? So we have to assess for the asthma. So these things, these two things that should be kept in mind. And if this patient is having any fever, so then we have to treat. So if there is any fever, we have to treat. Or if there is any wheezing also, so we have to treat. Okay. And most probably in this age group, this fever may be due to some problems with this ear, or it can be a problems due to this throat. So we have to assess as well as treat any ear problems or sore throat if it is present. So we have to assess as well as this treat any ear problems or the sore throat if it is present. Next. So we have to assess and treat any ear problems. Next, if there is any other problems, we have to assess and treat that also. So assess and also treat any other problems. If this child is having any other problems, we have to assess and treat. So after this treating, then we have to advise this mother. So we have to advise this mother to give home care. Okay, so advise this mother to give home care. So what are the home care advices that we should give the mother? So we should ask this mother to give any inhaled bronchodilators, so for about 5 days. Or also we can ask this mother to do soothe the throat. Okay, to soothe the throat with safe remedy. So to soothe the throat with the safe remedy, we have to ask this mother. Okay. So, and also we have to advise this mother when to return immediately. So we have also advised this mother when to return immediately. Okay, so these are the advices, or these are the things that we have to do so while managing a case of a no pneumonia. If there is no pneumonia, so if the cough is greater than 30 days, we have to do further assessment, and also we have to treat. So if there is any recurrent wheezing, so we have to suspect asthma. So if there is any fever, wheezing, we have to treat them, and any associated ear problems or sore throat that should be treated. And also we have to advise this mother to give this home care. So home care can be given in this form of bronchodilators, or we can give this soothing this throat with some safe remedies. Okay, now the second stage. Second stage, if this patient is in pneumonia, okay, so what will you do? Okay, so what is this treatment? Again here, we have to treat, so this fever, if present, we have to treat the wheezing if present. These two things should be done. Next, we have to give an antibiotic because this patient is having pneumonia. So we have to give here an antibiotic. So antibiotic should be given. Okay, at the same time, we have to advise this mother for what? So again, for home care. So home care, I have told you, this home care can be bronchodilators, or we can soothe the throat with safe remedy, etc. And also advise this mother, for what? To return. Advise this mother to return with this child, so within 2 days, for further assessment. So for assessment, we have to ask this mother to return. So within 2 days with this child, or as earlier if this condition of this child is getting worse. So these are the things that we have to do in this case of a pneumonia. Okay, so I have told you that we have to start here an antibiotic. So which antibiotic we will be starting? So which antibiotic? We will be starting the antibiotic Cotrimoxazole. We have to start the Cotrimoxazole. So this is the drug of choice. That is, Cotrimoxazole should be given. So how will you give this Cotrimoxazole? So Cotrimoxazole, it can be either given as a pediatric tablet, or it can be given as a syrup. Okay, given as a tablet or a syrup. If you are giving as a tablet, Cotrimoxazole, it consists of this sulfamethoxazole as well as trimethoprim. We know that it consists of sulfamethoxazole and trimethoprim. So in case of a tablet, this sulfamethoxazole, it is 100 milligrams, and this trimethoprim, it is 20 milligram. But in case of a syrup, the sulfamethoxazole is 200 milligram and trimethoprim is 40 milligram. Okay. So now we are decided to give this tablet to this patient. So it's according to this age. If this patient is less than 2 months, that is 2 months, weight is approximately 3 to 5 kg. So, or if this patient is 2 months to 1 year, so this weight is approximately 6 to 9 kg. Or if this patient is 1 year to 5 year, so that is weight is approximately 10 to 19 kg. So how will you treat? So this tablet, if this patient is less than 2 months, then we have to give 1 tablet BD. So, or we can give syrup 2.5 ml of this syrup BD. So if it is 2 months to 1 year, then we have to give 2 tablets BD. Or we can give, so this 5 ml of this syrup BD. If it is 1 year to 5 year, we have to give 3 tablets twice daily, that is BD. Or we can give 7.5 ml of this syrup BD. So this is the way that we have to start the antibiotic. Next, we will be managing a case of a severe pneumonia. Okay, so next is severe pneumonia. If this patient is having severe pneumonia, how will we do? So if the severe pneumonia, that means this patient is also having chest introing and also is having tachypnea, etc. So if the patient is having severe pneumonia, then we have to refer urgently to a hospital. So we have to refer urgently to a hospital, and also we have to give first dose of an antibiotic. So we have to start an antibiotic. First dose of an antibiotic should be given. So now we have to treat if any fever. So we have to treat if any wheezing. So like previous, and also we have to give the advice to this mother, So it is for this home care. So home care especially, so we have to again give these bronchodilators, okay, all those things, and also soothe this throat, etc. And most important, we have to monitor this food as well as fluid intake. So monitor food as well as fluid intake. And here we have to start this first dose of an antibiotic. So first dose of an antibiotic should be started. So how will we start the antibiotic? So there is an order. So first we have to start within first 48 hours. We have to start the benzyl penicillin. So benzyl penicillin should be started within this first 48 hours. It can be given 6th hourly intramuscularly. Okay, so and this usual dose of benzyl penicillin is 50,000 international unit per kilogram body weight per dose. So we have to start benzyl penicillin. If we give benzyl penicillin, either this condition can improve or this condition do not improve. So either it can improve or it do not improve. So if this condition is improving, then we have to change this benzyl penicillin to procaine penicillin. So we have to change the benzyl penicillin to procaine penicillin, and this procaine penicillin should be given for a duration of 3 days. So but suppose if this condition is not improving, then we have to change. So we have to change the benzyl penicillin. So we have to change it to this amoxicillin. We have to change it to ampicillin. So ampicillin, so this usual dose of this ampicillin, it is the 50 milligrams per kilograms per dose. Okay, so this is the dose of this ampicillin. So we have to change it to ampicillin. Again, if there is no improvement, we have to change it to chloramphenicol. So we have to change to chloramphenicol. And what is the dose of chloramphenicol? It is usually given 25 milligram per kilogram per dose. Or so again there is no improvement, then we have to change this chloramphenicol into cloxacillin plus gentamicin. So this is the way in which we will give an antibiotic to a patient having this severe pneumonia. Okay, so first we will start with benzyl penicillin. So if this condition is improving, we will change the benzyl penicillin to procaine penicillin and continue it for 3 days. So if this condition is not improving, we have to change the benzyl penicillin. So benzyl penicillin should be changed to ampicillin. So if it is not improving, again we have to change to chloramphenicol. Again, if it is not improving, then we have to change to cloxacillin plus gentamicin. Now we are moving to the management of severe pneumonia. So how to manage a case of the severe pneumonia? So next is severe pneumonia. So if severe pneumonia, very severe pneumonia, severe not very severe pneumonia. So if it is very severe pneumonia, again we have to refer urgently to a hospital. So urgently to a hospital. So here also we have to start this first dose of an antibiotic. So first dose of an antibiotic should be started. So then we have to treat the associated, that is we have to treat this fever. So we have to treat any wheezing if present. And sometimes the patient may be having other symptoms and he may be having cerebral malaria. So if this cerebral malaria is present, we have to also treat this malaria. And which antibiotic will be given in this case of a severe pneumonia? In case of severe pneumonia, very severe pneumonia, this drug of choice, it is chloramphenicol, very important. So we will be giving chloramphenicol intramuscularly. All these medications will be giving intramuscularly for 10 days. If there is no improvement with chloramphenicol, then we will be changing to cloxacillin. So we will be changing to cloxacillin plus gentamicin. So we will be giving, so then will be given IV. So this is the way we manage a case of a very severe pneumonia. Okay. So we have studied what are the signs of these different stages, that is signs of these different types of this pneumonia. Okay, so what are the signs? So we are having no pneumonia, pneumonia, severe pneumonia, or it can be very severe pneumonia. In very severe pneumonia, we will be getting these danger signs. And now we have studied about the treatment. So how to treat each cases of this pneumonia. So when it is no pneumonia, how to treat very severe. Okay, in all these treatment we have studied. Now, so generally for every pneumonia where we start an antibiotic. So in all cases, so antibiotics is used in all the 3 stages, that is in pneumonia, severe pneumonia, very severe pneumonia. In these cases we have used the antibiotic. In every cases we have used the antibiotic, we have to reassess the child. So this is important, reassess this child. So within 2 days, so whether there is any improvement or there is any worsening, or whether this condition is remaining the same. So if this child is worsening, the condition of child is worsening, then we have to refer urgently to a hospital. So if this condition is worsening, we have to refer urgently to a hospital, despite of this antibiotic therapy if it is worsening. So next, if this condition is remaining the same, then what we have to do? So we have to change the antibiotic. So we have to change the antibiotic, or we can refer. So, and if this condition of this child is improving, so if this condition is improving, then we have to complete the course of antibiotics. Okay, so then we have to complete the course of antibiotics. So in every case, we are starting this antibiotic treatment. So we have to reassess this child within 2 days. Okay. So if this condition is getting worse, we have to refer this patient. And if this condition is remaining the same, either we can change the antibiotic or we can refer, or if it is improving, so we have to complete this course. So this completes, so this categorization of this pneumonia in a child aged 2 months to 5 years, and also this treatment of the same. So now we are pending with this discussion of the categorization of pneumonia in a child less than 2 months, and also this prevention of this pneumonia. So this we will deal in this next session. So guys, so if you have understood something from my session, so you please just like my video, share, and also subscribe. Okay, thank you then. Bye bye.